What is up, everyone? Welcome back to another video. I just wanted to check in and talk a little bit about what this year of my postdoctoral fellowship has been like and just take you guys along in this journey and share what's on the horizon. So for those of you who are new here, my name is Danica. I am a PhD graduate in clinical psychology as of May 2024. I started my postdoctoral fellowship 2024 to 2025, starting in September and ends in late August of this year. So during this fellowship, I am focusing on forensic psychology, so focusing on forensic evaluation, so competence to stand trial, criminal responsibility, evaluations of incarcerated individuals, risk assessments, and things of the like. Part of my training also includes being certified or receiving my credentials as a designated forensic psychologist. So there are certain states that require this. In the Commonwealth of Massachusetts, that is a requirement in order to do independent forensic evaluations. Now, you could do evaluations, but it would be under the license of someone who is a credentialed designated forensic psychologist. And the hope or expectation is that supervisee, who is being supervised, is in process of receiving their credentialing as a DFP. Right now, I am a little past the 6-month or halfway mark of my fellowship. So I spent the first 6 months focusing on inpatient forensic evaluations at a Department of Mental Health facility. Some of my responsibilities include attending forensic didactic, talk about mental health law. We talk about some seminal case law that really supports the work that we're doing and that we need to be familiar with. Hi. We talk about testifying, what it's like to prepare for that testimony, the things you do want to do and don't want to do while testifying, and just everything related to managing your anxiety with testimony. We also talk about professional development stuff, so various didactics on different avenues that you could go down in forensic psychology, so not just criminal related forensic evaluations, but that also includes civil litigation evaluations. So this is like fitness for duty, personal injury, as well as disability related evaluation. So for the latter half of the training year, I'm spending it at a maximum security facility in Massachusetts. And this is similar to the work I was doing at the DMH, or Department of Mental Health facility. It includes some of the same evaluations: criminal responsibility, competence to stand trial, competency update evaluations as well, evaluation of people who are incarcerated. The difference here, there are several key differences. One includes the volume of reports that you get are significantly higher than what we did at the Department of Mental Health, and there are several reasons for that I'm sure contribute to that, but that's just the nature of the work at that facility. It also includes more severe or more violent related criminal offenses. So these are individuals who are awaiting trial, they're pre-trial. So again, someone is going through the criminal process, they are alleged to have committed an offense, someone raises the question about, oh, something might be going on that might be mental health related, and we should get this assessed because it is a violation of their constitutional rights, their due process rights to continue in their trial if they have a lack of knowledge due to mental illness, or lack of knowledge surrounding the legal system and surrounding their case due to intellectual disability, due to limited exposure to the criminal justice system. It is very intense in terms of the workload, but I think I'm adjusting relatively well. It has given me an opportunity to really get close with some of the other fellows who are also doing this rotation with me. I forgot to mention, in my first half, of my fellowship, I also did what's called an MIPSB rotation, which is a mental illness problematic sexual behavior rotation, and that was also strictly evaluation. So I'm doing no therapy during my fellowship year. So that MIPSB rotation includes assessment of individuals who have sexually related criminal offenses, or they have exhibited significant problematic sexual behavior, whether that would be in the hospital, whether that would be in the community, and the concern is great, or the risk is great, that it requires a very in-depth or comprehensive evaluation. And so what you're doing there is you're essentially providing an overview of who the person is, where are they coming from in terms of which facility, what exposure to life events, so kind of like this biopsychosocial. And then we're getting into the criminal history, specifically involving the alleged sexual offenses, or if they also have been convicted of that offense. So we're detailing that out. You're obviously interviewing the patient to also supplement your information to ensure that your report is as accurate as possible, or even highlight where there are some gaps as well. The bread and butter of this evaluation is to draw, if possible, a connection between the problematic sexual behavior and mental illness. There isn't always a connection, meaning there isn't always mental health symptoms that are influencing these problematic behaviors. Sometimes it could be just due to a genuine inappropriate interest in this behavior, but it could also be driven by mental illness, and that could look like this individual perhaps has bipolar disorder. When they're experiencing mania, they're also experiencing hypersexuality. So perhaps some sexual preoccupation, appropriate touching, and perhaps even more severe than that. And the thing that's interesting about that, it's not necessarily that, oh, this individual only has these inappropriate interests when they're manic, for example. It could be this idea that there are these underlying interests that are sort of dormant, if you will, when the individual is less symptomatic or stable on medication, and the intensity or acuity of their symptoms sort of exacerbates that interest or brings it to the surface because their inhibition is lowered. Again, not clinically stable, so they don't have necessarily the good judgment to not act on these thoughts or impulses or what have you. So that is just one example. So going back to my latter half of my fellowship, it has been a very, very busy year, but it has also been a year where I've learned so much. It was funny because I was telling my friend, I feel like my head is like Jimmy Neutron just because I have like all this new knowledge that's in my head, which is wonderful. And that's exactly what you would hope when you're getting very specific or specialized training. In this last 6 months, I'm also doing by far my most favorite rotation, which is the court clinic rotation. And that is doing forensic evaluation on an outpatient basis. The difference here is that these are screeners. So they're not the comprehensive, full reports or evaluations that you would do at an inpatient basis. So the process in the court clinic is the defendant is appearing for their court hearing. During that time, there is a question about their mental illness. And it could also happen that, you know, maybe they appeared in the court a week before and now, you know, a psychologist has been assigned to do that evaluation and the jail is bringing them to complete that. During that time, you would do an on-the-spot evaluation. So you would have a private room, or sometimes you're sort of not in a private room, but less private than if you were sitting in the actual courtroom. So there's like basements where the defendants are housed, and sometimes you'd have to do the evaluation there. you're essentially asking all of the same questions, but the challenge is that the report is condensed and you're not going into as much detail as you would in a full evaluation, not because it's not necessary, but you're getting just enough that you could make an opinion as to whether or not this is a concern or this isn't for this individual. Again, the challenge here is that you're condensing so much data into a 3-page report versus a full competency stand trial evaluation could range from 13 to 17 if you write a lot like myself. And so what you're doing here, you're making an opinion as to how that defendant is presenting currently, and are there concerns that warrant further evaluation. The beauty here is that you need to be very familiar with these forensic mental health evaluations, because you need to know the most salient points or things that you need in order to answer that question. So it is a really interesting way to apply your knowledge, and I love it for many reasons, largely because court opens at 8:30 or 8 o'clock, closes at 4:30. We're done. Inpatient, 24 hours, right? The hustle and bustle of an inpatient, the demand of the inpatient just doesn't align with my values or my lifestyle in terms of wanting to not take work home with me every single night, working in a more intimate, close-knit environment where you are collaborating more on the spot with individuals. So in the court clinic, you have the attorneys who you're really familiar with or in good communication with because you see them all the time. They're there to answer questions or sitting in on the interviews. You have a close relationship with the judge. So there are various judges. So if you're working in the same district court, sometimes you get stationed in different ones. You know the judge, and the judge begins to know you, which is very nice to have. And that is also great for someone like myself who's interested in building a private practice. So having that network, that professional network, will serve as helpful in opening doors for myself, but also being able to expand and provide my services. So that's a little bit about what I've been doing in a nutshell. I am also, at the same time, applying for jobs, studying for licensure, and it is very surreal. I think I'm having a lot of reflection about my time in grad school and just how far I've come. While I was in grad school, I could not see the light at the end of the tunnel. It was very difficult to do because I was in grad school 6 years, and that is a very long time, right? Like, it is a very long time to think, oh, 6 years is gonna fly by. And it's not like college where I feel like, I don't know if it's just because I'm a little bit more removed now from college that I'm looking back and being like, oh my God, like it flew by. But it actually did, I do remember that. I also think there's less like variation in how long it will take for you to finish college. Like, yes, it does happen where individuals take a gap year or they transfer or they're on leave or they end up doing a combined master's and undergrad program, whatever the case is, but those are few and far between. Like, that's the minority versus a PhD. It depends on many things. It depends on where you're at with your dissertation or your research. It depends on whether you match for internship. So there are so many contingencies within grad school, so it makes things a little bit more ambiguous and have more gray area. Anyway, I've just been thinking a lot about like my life at the time, where I was living, and I'm just, again, very grateful and appreciative to have now be on the other side and be able to apply my knowledge in my day-to-day work, but also be able to share it with you all. Like, that is what I want to be known for. I want to be known as an educator. I want to be known as a mentor. I want to be known as someone who is willing to be vulnerable and try new things, and also able to talk about the mistakes and how I've come back from that. So I want to do another video on like time management, things I've learned in grad school and so forth, because I think those have been my most prominent or salient life lessons, and there's still a lot to learn there, because with every job you're adjusting and adapting to that environment that requires you to use your time management skills or your work ethic a little bit differently just to fit the demands of the job. So yeah, I just wanted to share that with you all, and I will be making a video very soon about some of the topics that I talked about, but I hope to catch you in the next one. And I've been getting a lot of messages about people wanting to connect and talk about their career. That is also something that I am working out right now, the details of having a little consultation, sort of a package deal for you all. I think that would be really, really cool, and I'll talk more about that. But please, please, please always feel free to reach out in the comments, reach out on my Threads of Tenderness Instagram page. My email for the Threads of Tenderness page is also detailed on my YouTube page in my bio, so always feel free to reach out. Thanks so much for watching, and I will see you in the next one.